Hi friends, I am Joel John from Joel John J YouTube channel. Now we are going to discuss about charge entry process key fields to know. And if you are listening on podcast of this, search as Joel John J on YouTube search box JOEL space JOHN space J or demo and charge entry process by Joel John J in YouTube search box to get the playlist. And at the end screen, if you find it on YouTube, at the end screen, I will give you the entire playlist of this demo and charge entry process. This is the third video I am making because if you don't watch continuously, but each video will be self-explanatory. But if you don't watch completely, you won't be able to understand the full process. In future also, I will add some more videos. So now these key fields are all important interview questions. So that's why I haven't added an FAQs separately because these are the key definitions or the key words which you should know to do the charge entry process effectively. So I will first give an introduction about what is charge entry and then go through the various steps. And these things will be like it will be the best forms to answer on the interview. It won't be like very in depth into the process. Already we have went in depth into the process on the previous video. So when you watch the playlist on order, you will be able to understand that as well. So getting into the topic, what is charge entry? After receiving the super bill from the doctor office, it gets passed through the coding and pre-coding department and then comes to the charge entry department. It is only here in charge entry team the claim/bill is created actually. Once the super bill is generated from the doctor office, when it goes to the coding and pre-coding team. There they do the medical coding for that. After that, when you submit the form to the insurance company, there it should be coding and then the charges relevant to that and other important details. In this video, we are going to see what are all the important field names in US medical billing and have an understanding on that. A charge entry person looks up the codes entered in the claim and to assign the relevant charges for those codes. This is also one of the key functions in medical billing, as there should not be billing, any upbilling done by assigning an incorrect charge for the code. So if you the correct exact value should be mentioned there. So it's a very key function. Entering all the relevant information needed and creating a claim form. There are two types of claim form, UB04 for facility charges and CMS 500 for provider charges. In US, when you go for a treatment, the hospital will give us, for hospital, there'll be a separate charge. And for doctors, there'll be a separate charge. Doctors or the caretaker. There will be a separate charge for that. Okay. Ready for auditing and then from transmission to the insurance company. After doing this charge entry, there will be an auditing because any mistake, the claim will be rejected. And also, if there is any format error, the claim will be dropped as a dropped claim. And those details will be on the scrubber report. Okay. And then how do charge sheet originate and reaches us? Once the patient or his spouse completes the PD stands for patient data sheet here. The patient is then referred to the physician at the appointment time. After preliminary investigation, the physician provides the service required by the patient. In the super bill, the kind of treatment is denoted by the procedure codes, CPT codes, and diagnostic codes, ICD-10 codes denotes the nature of illness for which the service is administrated. So what the disease is given by ICD code and the latest classification is ICD-10. And what are the treatments which are doing and what are the procedures which are being performed are given by diagnostics which are done are given by CPT codes. Okay. Super bill or charge sheet contains information like date of service, kind of service, diagnosis codes, attending doctor, and modifier details. Super bills are usually completed by the physician or their assistants. So if the doctors or the coders know there is a need for a modifier for this code to be used, then they will itself add it. But when it goes for denial and then it comes back, the AR analyst or the AR, caller will check whether it could be built with a modifier. Then they will get back to the doctor team, and then they will get a note for that, and then they will add the modifier. Or in some cases, if it's missed out, the medical coding team themselves will add the modifiers. Coding diagnostics and procedure are done by the coding specialist. Once the charge sheets are completed, they are patched with the PD at the physician office and are forwarded to the charge entry. The mode of transfer of data may vary from client to client, but the most preferred mode is FTP, file transfer protocol. This question they even ask to freshers, because what's the full form of FTP? To understand your system knowledge, it's file transfer protocol. Here, patient demographics are scanned and captured as an image file. These image files are placed on the FTP site. These image scan files are retrieved by the demo and charge entry team, and the image files will be uploaded and the details will be captured in the practice management software. This is where the beginning things happen. Mostly the demo entry team will do all this work. If even in charge entry, the demo entry is this process, getting information, uploading into the PMS, and then also uploading the scanned images, diagnostic images, whichever they send. After that, the charge entry part begins. So on that, information found in the patient charge sheet, which are all the important information, we are going to see that. The attending physician, referring physician, admitted date, date of service, type of service, place of service, prior authorization number, modifiers, procedure codes, diagnostic codes, number of days, number of units, location details, physician name, address, and provider ID. Now we are going to see about each of the important terms and what does that mean. Attending physician. So all these will come as a question in the interviews. They will ask who is an attending physician, who is a rendering physician, what's the alternative name for attending physician, like that they will ask so many questions. So watch this thoroughly, and also if you are watching the video, you can stop the video and write it down if you are unable to remember, so that you will be able to memorize that. Attending physician. The attending physician is also referred to as rendering physician. Why he is referred like that? A physician who renders the service to the patient is called as attending or rendering physician. He is rendering the service, right? Or he is attending you. That's why they call with that name. Each rendering / attending physician of a particular facility is assigned a unique code with the name of the physician, address of the clinic / facility, then PIN, the provider identification number, then license number and federal tax ID, where rendering physician details are found in the CMS 1500 form. The rendering physician name, address, and PIN are printed in the 23rd field, and if the address of the facility where the services was rendered differs from the physician location, then that address is printed in the 32nd field of the corresponding federal tax ID of the provider is printed in the 25th field of the CMS 1500 form. Then we are going to discuss about the referring physician. The physician who refers the patient to the specialist is called as referring physician or primary care physician, because he is taking the primary care of that patient and then he is referring to a specialist. And as he is referring to another doctor who is a specialist, he is also called as referring physician. Information is integral to continue the care. So he will be sending out some information so that you can continue the care and also get reimbursed from the insurance company, and community relationship. The physician who has sent the patient beneficiary to another physician, or in some cases to a supplier, example, physical therapist, occupational therapist, or consultation or treatment, is known as referring physician. So the person who is sending this for this patient to these people, physical therapist, occupational therapist, or to a consultant, are called as referring physician. Each referring physician is allotted with a unique code in medical billing software, which stores the name of the physician, the address of the clinic or facility, and the UPIN. UPIN stands for Unique Physician Identification Number. This is also a very important question for senior people. What's the full form of UPIN? Unique Physician Identification Number. Where referring physician details are found on the CMS 1500 form. The referring physician name is printed in the 17th field of the CMS 1500 claim form, and UPIN, which is stored along with the code, is printed on in the 17A field of the CMS 1500 claim form. Admit date. Admit date refers to the date on which the patient was admitted into the hospital. So when the patient is admitted in the hospital only, it's called as admit date. Okay, so it's different from date of service. And another one term which is used for workers' compensation is they will mention the date of injury. That's some very important for processing claims in workers' compensation. We look at that as well. Date of injury, DOI, is very important for processing the claim. For the purpose of determining the date of injury for an occupational disease, the date of injury shall be taken to be the last date of the injury exposure to the hazard of such disease, or the date on which the employer first knew or reasonably should have known of the condition and its relationship to the employee's employment, whichever is later. Okay, so it's like when they know that they are suffering some occupational disease, or when they reasonably find out this condition is because of the occupation, I have got this disease. So these are called as date of injury for claiming regarding to occupational diseases. And also if it's an accident or something, the date in which the accident happened will be the date of injury. Okay. Then date of service. Date of service is the date on which the service was rendered to the patient by the attending physician. The date of service will be in single date format. The standard format for entering date of service is a 2-digit month slash, that's backward slash, followed by 2-digit date, backward slash, 4-digit date. DOS, date of service, must be greater than or equal to the admit date. So in case of inpatient, after admitting only, the date of service should be greater. Okay. Type of service, or TOS. The type of service TOS which was administered to the patient. Broadly, we have 2-digit TOS codes that need to be entered in the block 24C of the CMS 1500 form. The type of service defines what type of service. It's like, is it a radiology or a cardiology, those kinds of things. Okay, etc. Place of service. Place of service is shortly given by POS. These also they will ask us questions. 2-digit place of service needs to be entered in the block 24B of the CMS 1500 form while submitting the claim to insurance carrier. POS can be for inpatient, outpatient, and emergency room. So these are some point of service which they have mentioned over here, because these are the most commonly used. Apart from that, also there are a lot of POS. We will look at that at a much later time on a very different video, because that's a very huge topic. Okay. The health care that you get when you are admitted to the hospital is an inpatient. Medical or surgical care that does not include an overnight hospital stay is an outpatient. If you are not going to stay in the hospital for a whole night, then it's an outpatient. You come and go. If you are staying in the hospital for the night, then it's an inpatient. So this is a very, very important question. They mostly ask this for the senior people. Care given for a medical emergency when doctor provider believes that your health is in a serious danger, when every second counts is or emergency care. So this is a definition for emergency care. This is also very important. This field consists of the place of service or location where services were provided to the patient. Location details are printed in the block 32 of the CMS 1500 form. Details like location name and address are printed. Where services are rendered in the patient's home or physician office, location details in CMS 1500 form can be blank. The patient home or physician office, that block can be blank. That's not a mandatory, but may vary depending on some insurance. So also be careful about the payer for whom you are working for. Pre-authorization, an insurance plan requirement in which the patient or primary care physician, PCP, must notify the patient's insurance company in advance about certain medical procedures like outpatient surgery, which this is given as an example, in order for those procedures to be considered as covered expenses. So these prior authorization requirements completely depend on the type of treatment and the plan you have. But if you the explanation of benefit team, there will be a team which also works before the charge entry begins. They have to verify and give this detail whether prior authorization is required for that service or not to this team. Okay, to the charge entry team. Prior authorization is of two types: requesting authorization of date of service that has not been previously requested, or requested was previously rejected. So based on some criteria, you have to you can also request for a previously rejected authorization and get it done, or you can, if it has not been previously rejected but it requires, then you have to get a new one. Requesting authorization to increase or decrease the units for previously approved date of service. In other words, prior authorization means insurance is notified in advance about specific procedure. This allows for a review of medical necessity, efficiency, and quality of proposed care. It is also an opportunity to inform patient and physician about benefits, including length of stay guidelines and plan limitation. This will help to understand the cost if the patient receives the processed care. Okay, so it's like if it's prior authorization, even though it's not a guarantee for payment, it gives a belief that this will be reimbursed. Otherwise, that amount will be borne by the patient. Even predetermination, they don't give a guarantee, but that will give a much detailed figure about the medical expenses. About that also, I have made a video that also I will add along with this. Note, for emergency room services, on the playlist I will be adding. Okay, but I will do that on a later stage. But for prior authorization itself, I have a separate playlist. I will give it at the end screen. Have a look at that. There it will well explained about prior authorization, referrals, as well as predetermination on those playlist videos. Okay. Procedure codes. Procedure codes are used to indicate the kind of treatment or services administered to the patient. Utmost care should be taken while entering the procedure codes. We need to first know what kind of procedure code each insurance accepts to process the claim. So there are also some few different types of procedure codes based on the insurance plan type. The charge entry team should know about that. Then they have to work on that, because in medical coding they would have given the CPT codes and ICD-10 codes. But if it's that requires a healthcare common procedure coding system, HCPCS is the coding system that is proposed for, that is composed of. So we are going to look at the healthcare common procedure coding system, HCPCS. This is also a question. What's the full form of HCPCS? Healthcare common procedure coding system. And what are all the different types of codes which this comprise of? The level 1 codes will be current procedure terminology, CPT codes. Level 2 codes are national codes. Level 3 codes are local codes. Level 1 CPT codes are 5-digit numeric codes that describes the procedure and test. CPT codes are developed and maintained by American Medical Association, AMA, with annual updates. Once in a year, they update the CPT codes. And who does that is American Medical Association. In short, it's called as AMA. This is an important question for senior level people. Level 2 national codes are 5-digit alphanumeric codes that describes pharmaceutical supplies, procedures, tests, services. And level 2 codes are developed and maintained by Center of Medicare and Medicaid Services, CMS, with quarterly updates. This is also very important. You should know when they use the level 2 codes, when they use to describe pharmaceuticals, that's medicine, supplies. And supplies are like a wheelchair, or if they need a hearing aid, those kinds of things. And if they need a thermometer, or those kinds of, or pressure checking machine, or sugar, diabetes level, blood sugar testing machine, if it's really medical necessity, those will be given by level 2 national codes. Okay, and these are maintained by the CMS. CMS stands for Center of Medicare and Medicaid Services, and these are updated for every quarter. They update this list. So this also is a very important question for senior level people. Level 2 local codes or 5-digit alphanumeric codes that are being phased out by the official intermediaries. The Medicare official intermediaries, FIs, are private insurance company that serves as the federal government agent in the administration of Medicare program, including the payment of claims. In other words, this field contains the code of the procedure done, CPT or HCPCS codes. The purpose of the CPT code is to provide a uniform language that accurately describes medical, surgical, and diagnostic services, and thereby serves as an effective means for reliable nationwide communication among physician, patients, and third parties. All the procedure codes are stored in the master database of the medical billing software with a description of the code and the dollar amount. This helps the charge entry person to cross-verify the procedure before saving the claim. So as all these are stored on the master database. So even though it's stored on the master database, you can do a manual check so that you verify that and then send the form to avoid errors. This field is printed in the 24D and the corresponding dollar amounts of the procedure stored in the medical billing software is printed in the 24F field of the CMS 1500 form. And the only one question in addition to this I have added is, what are the items to be included in the patient data sheet? That's what I told in the earlier, right? The sheet which the patient or his spouse fills before getting the appointment with the PCP or the specialist. Okay. What are the items to be included in the patient data sheet or PD sheet? Patient demographics, that's his place details, including the date of birth, age, gender, race, ethnicity, preferred language. Because if the patient speaks in one language and which the doctor cannot understand, then it's very hard to give a treatment, right? So preferred language, contact information, religion, education, and occupation. These are the details which must be in the patient data sheet. Okay, friends, with this, we come to the end of this video. And by the time you will be having my playlist, which one will be for the entire playlist for the charge entry process. And another one will be for demo and charge entry process. And another one will be about prior authorization. And another one will be about my entire US medical billing playlist. So all these will be on the end screen. Look at those and watch all the videos to get a full understanding for demo entry and charge entry process also. Definitely watch all those videos first so that you will get a complete understanding. And in future also I will add up some videos. So subscribe to my channel, press the thumbs up icon below all my videos. If you have any queries, share it on the comment box. I will try to answer it on that itself. If it requires a video, I will work on that and I will post the video once it's possible for me when I get the time. And other things like share this video with your friends and have a discussion with them. Watch the full playlist when you get a time so that you will get full thorough understanding, and wish you a very good success in your job roles and interviews so that you can climb up the ladder and also get placed on suitable jobs. And with a lot of wishes and greetings, it's your Joel Janji signing off from you. Bye.